Uh, so we will be using a separate PowerPoint because we only have this day today, and then next week you will be having your final exam na. Tama? So, para matapos po natin yung remaining topic, so I also uploaded this one. Hindi ko na tinanggal yung lumang PowerPoint na nakalagay. But we will be using this PowerPoint and then we still have one more PowerPoint. So after this one, we're going to have our lunch. Okay? So, still our topics about nursing care plan. So when you see nursing care plan, this is utilization of the nursing process to, wait lang. To construct individualized plan of care. So when you say individualized plan of care, so ibig sabihin, the problem or the nursing care plan na gagawin mo sa akin may not be applicable to the other patient. So ibig sabihin, ang goal ng nursing care plan mo is directed dun sa need ng pasyente. So let's say for example, if you have same patient complaining about fever, hindi porket they have the same problem, you will have the same objective or the same intervention. Okay? Kaya sabi dito, ang nursing care plan is a individualized plan of care. So because the plan may vary based on the case or based from the need of the patient. Okay? So how can you determine what specific plan of care are you going to perform? So of course, you need your critical analysis and you need to assess your patient. So yung assessment mo is very vital because that is your foundation on what will be your nursing diagnosis, what will be your plan, and what will be your intervention. Okay, so kung hindi maganda yung assessment mo sa pasyente mo, then definitely magkakaroon ng rebound yun kasi baka mamali ang pag-identify mo ng nursing problem. Same thing with your goal and your nursing intervention. Okay, so first, assessment is very vital in doing your nursing process or your nursing care plan. Okay, so when you say nursing process, this is a systematic method. So when you say systematic method, definitely you cannot proceed with the second step without doing the first step first. However, even though it's called systematic process, pwede kang bumalik pa rin even though you are done with the assessment. Kasi di ba ang nursing process natin, we have assessment, diagnosis, we have the planning, and then we have intervention, and then we have the evaluation. Okay? But even though you are done with the assessment, tapos nasa intervention ka na, still you need to perform your assessment. Why? Kasi doon mo malalaman if your identified intervention are correct. Let's say for example, balik tayo sa TSB, balik tayo sa fever. So ang goal mo doon ay mapababa ang temperature ng pasyente. Okay, so let's say for example, you have fever. Okay, you have 38. So ang goal natin dito, ang problem natin dito ay hyperthermia. Okay, hyperthermia. Okay? So ang goal natin dito is to lower down the temperature. Okay? And then you have your intervention. So ano mga pwede natin gawin sa pasyente kapag mataas yung fever niya? Number one, pwede mo siyang punasan. Okay? So pwede mo siyang bigyan ng maraming fluid. Pwede mong bawasan yung mga suot ng katawan. Pwede mong buksan yung aircon. Okay? So even though ginagawa mo ng intervention mo, okay, nasa intervention part ka na, pwede mong gawin simultaneously ang pag-assess mo. Why? Because you want to measure if your identified intervention are actually helpful. Okay? Dun sa pasyenteng ginagawa mo. Kasi baka naman mali yung intervention mo, so kailangan mong i-revisit yung nursing diagnosis mo. Okay? So even though nang sabi niya dito, ang nursing process is systematic method, is still, once you're done with the assessment, you can still always go back or you can do two-step, okay? Kahit tapos ka na. Okay, so when you say systematic method, ibig sabihin you need to start with your assessment. Why? Kasi because your assessment, this is your foundation, this is your information, okay? Or these are your data. Okay, without this data, you cannot proceed what will be your problem, what will be your goal, and what will be your intervention. Okay, so nursing process is a systematic method giving humanistic care that focus on achieving outcomes in a cost-effective manner. So when you say achieving outcomes, so definitely your intervention should directly affect or should help you in achieving your goal. Okay, so wag kang basta-basta maglagay doon ng mga intervention para lang humaba yung discussion mo ng intervention or humaba lang yung malagay lang na marami kang ginawa sa pasyente kung hindi naman yung directed sa problema ng pasyente mo or hindi kung hindi naman ito makakatulong doon sa identified problem mo. Okay? Okay, ang ingay. Okay, so nursing care plan is written guidelines for client care. Guys, it's client care. Okay? So it's a client focus, not nurse focus. Sir, anong difference nun? Kasi baka naman gumawa ka ng nursing care plan mo, convenient mo ang inisip mo. Okay, so bawal ganun. Why? Kasi dapat ang goal ng nursing care plan mo is to help your patient. Okay? Is to take care of your patient, to lead your patient into recovery. So dapat kapag gumagawa ka ng nursing care plan mo, it should be client focused or client centered. Okay? So ito yung sinasabi niya, written guidelines for the client care. So it's not nurse focused. Okay? Organized so nurse can quickly identify nursing actions to be delivered. So when you say organized, okay, even though you're going to have your assessment and then you identified na daming mo problema. Okay? So ano bang kailangan kong unang gawin? Okay? So ano bang pinaka-priority? Okay? Then coordinate resources for care, especially if you need the help of other healthcare team. Yan. Enhances the continuity of care. Why continuity? Because you will have the record on what are the things you already performed or you already identified. Okay, then organize information for change of shift or report. Then what are the nursing process? Okay, so ang sabi natin kanina is systematic. Okay, so when you say systematic, you need to perform the assessment first and then diagnosis and then planning, implementation, and your evaluation. So this is your ADPI. However, sabi ko nga kanina, even though na sinasabi niya is systematic approach, even though you are on the part of the implementation, you can also do the assessment. Why? Kasi you want to check if your identified implementation are actually effective. Nakatulong ba yung mga na-identify kong intervention? Okay? Or naka-anchor ba yung mga identify kong intervention do sa sinabi kong goal ko? Di ba? So even though you are done with the assessment, you are done with diagnosis, you're done with the planning, implementation, pwedeng simultaneous, pwede mo siyang gawin. Even though na sinabi niya systematic. Okay? So you start with your assessment. Ano yung assessment? Ito yung you're going to interview your patient, you're going to observe your patient, you're going to get other informations that are vital. So pwedeng yung mga emotional factor niya, religious factor niya, physical exam niya, interview niya, previous hospitalization niya. So those are the data that you need to gather from your patient. Ngayon, kung bata siya, you try to ask or get data from the significant others. Then from that data, okay, sabi nga natin yun, that is your foundation, di ba? That is your foundation. Okay? So yung assessment mo, dahil yun ang foundation mo, then you can use that one to identify a nursing diagnosis. So sa nursing diagnosis natin, di ba, we have 2. Okay? Actually 3. Yan. Na-discuss natin last time. Pero commonly, ang ginagawa natin dito is you have your actual and you have your potential. So when you say actual, this is the existing problem. And then when you say potential, these are the risks. Okay? And then planning, what is your goal? Anong goal mo? To top the board exam. Okay? Ang goal mo, you can identify whether short-term goal, okay, or your long-term goal. Okay? Then your implementation. So under implementation, you have your independent, okay, and then your dependent, and then you have your collaborative. Okay? Under evaluation, okay, under evaluation, okay, under evaluation, you also have 3. So number 1, it's either goal met, goal partially met, or goal not met. Okay? So why use nursing process for care? So based on principles and rules that promote critical thinking in nursing. So critical thinking is very important because it will help you to identify correctly what is the concern or what is the problem of your patient. Okay, so putting it all together, I think nasabi ito ni Ma'am si Ma'am Marge last time, na yung mga information na nakuha mo sa pasyente mo, you're going to synthesize. Okay, so you make it a general problem. You make it a general diagnosis based from the small information na nakuha mo sa pasyente. Okay? So putting it all together, so you have your assessment. So the first step in determining a patient health status is you're going to assess. Okay? Nagtanong ka sa pasyente mo. Okay? Gamitin mo yung physical exam mo, ang IPPA mo. Ayan. Then gather information, put pieces of the health puzzle together. So ito yung tinatawag natin, you're going to synthesize. Okay? Yung mga lahat na nakuha mo during your assessment. Okay? Then entire plan is based on the data you collect. Data needs to be complete and accurate. So ito yung sinasabi ko kanina na dapat maganda ang pag-assess mo sa pasyente. Because kung mali ang naging assessment mo, di magiging mali na lahat yung nursing diagnosis mo, yung nursing goal mo, and even your identified intervention. Okay? Then you need to collect, verify, and organize data, and identify patterns, report, and record the data. So when you say organize and you create a report and record the data, so these are the information wherein you can compare your first assessment to sa second assessment mo. Okay, then report significant abnormalities immediately, especially if this is a life-threatening. Okay? So we will do this one, the case scenario, later after the discussion. Okay, so assessment. So this is the first step in determining health status. Okay, so again, this is the first step. Ang sabi nga natin kanina, the nursing process is a systematic approach. Okay, and the first step is your assessment. Okay, so you need to gather information. So how are you going to gather information? Either you're going to interview your patient or you're going to observe your patient. Okay, so pwede mo siyang tignan, pwede mo siyang amuyin. You can perform your IPPA, your inspection, percussion, palpation, and your auscultation. Okay, so because these information are vital so that you can identify the correct nursing diagnosis or your second step. Okay? Then third, gather all the puzzle pieces. Ito yung nasabi ni Ma'am Marsh last time. Yung mga small information mo, okay? Yung mga small information mo into a bigger picture. Okay? To put together a clear picture of the health status. Okay? Then entire plan is based on data collected. Okay? So hindi pwedeng gumawa ka ng plano na wala naman sa in-assess mo. Okay? Or gumawa ka ng plano kasi ito yung tinuro sa'yo, ito yung nabasa mo sa libro. Hindi. Kasi di ba, kaya sabi natin kanina, your nursing care plan is a client-centered because this will vary based on what your patient is experiencing or complaining. Okay? Then data needs to be complete, accurate, and make sense of patterns. Okay? So we have these 5 activities needed to perform systematic assessment. First, you need to collect data. Okay, so when you collect data, so you can either do interview, ayan, and your observation. Okay, so once you have your data, then you need to verify. Okay, para malaman mo tama ba? Okay, and then you're going to organize. Ano yung organize? Okay, so yung mga nakuha mong signs, symptoms, or yung mga nakuha mong manifestation, or yung mga nakuha mong data from the patient, you're going to group it. Okay, para makapag-identify ka ng problem. Okay, because sometimes there are a lot of problems, okay, that are not cannot be under one umbrella. Okay? So let's say for example, meron kang lagnat, then meron kang pain. Okay? Lagnat and pain are 2 different nursing diagnoses. So you're going to cluster your problem. Okay? Kaya ang sabi dito, you're going to identify the patterns. Okay? So yun. So after you cluster, you're going to check your gathered data. And then you're going to report and record the data. Okay, so this is a good example if you're going to interview your patient about the pain. Okay, so just imagine, okay, ang gusto niya malaman dito is about pain. Okay, pain. Okay, una yung tanong, are you having pain? Okay, your patient can also answer it by yes or no. Tama? Or you can also ask your patient how high the pain scale using the pain scale system of 1 to 10. Okay, but you can also use your observation like checking the facial grimace. Tama? Then, tell me how long it has been bothering you. Okay, gaano ba katagal daw mo nararanasan yung pain? So, hindi siya tumigil dun sa pagtatanong niya na, are you having pain? And then gusto niya malaman saan located yung pain. Why? Because the location of your pain will help you identify and create a more applicable nursing diagnosis. Okay, baka naman kasi ang pain niya is due to post-operative site. Okay? O baka naman yung pain niya due to injury. Okay? Then is it your hand, wrist, or lower arm? Okay? Then describe the pain for me. When you say describe the pain, nagra-radiate ba? Okay? Or centered ba? Or focal lang ba? Okay? Or centralized lang ba? Okay? Then in what way does it affect you normally? Okay? So why do you need to ask this question? Because gusto mo malaman how the complaint of your patient affects, okay, his or her daily living. Are you able to dress and feed? What do you do to relieve the pain and is it effective? Okay? Bakit mo tinanong to? Kasi baka naman meron siyang ginagawang mga activity. Let's say for example, umiinom ba siya ng gamot? Okay? Or kung meron ba siyang ginagawa, let's say for example, warm compress. Okay? Para malaman mo kung gagawin mo pa rin yun for the succeeding intervention mo. Okay? So just imagine, ang kinukuha niya nitong data ay pain. Pero ang dami niyang tinanong. Okay? Because all of this information are vital. Okay? Para makagawa ka ng magandang nursing care plan. Okay? So, comprehensive data collection. So, begins before you actually see the patient. So, okay? So, nurse report from ER or the chart review. Okay? So, pwede mo na i-check yung patient chart para makita mo kung ano na bang merong existing data sa kanya. Okay? Then, continues with the admission and interview and physical assessment once you meet the patient. Okay, di ba kapag dumating yung pasyente, tinatanong natin siya, anong problema po, anong complaint po, ano pong nararamdaman nyo. Okay, and then you also do your physical assessment so that your physical assessment will validate, okay, yung mga data na nakuha mo sa pasyente. Then other information resources included family or significant others, especially if yung pasyente mo ay bata pa lang, di ba? Kasi hindi ganun ka-reliable kapag bata yung pasyente. Okay, and then you also have your nursing records. If meron siyang old medical records, yung mga diagnostic studies and relevant nursing literature. So bakit meron kang relevant nursing literature? Because this will help you in identifying a correct nursing diagnosis and even will suggest what are the possible intervention. Okay? Then consider the age, the growth, and the development. Sir, bakit po napaka-importante ng age, growth, and development? Because you need to tawag dito, consider. Let's say for example, kung matanda na yung pasyente mo. Okay? So ano ba mga nursing intervention ko na applicable sa kanya? Same thing kapag bata ang pasyente mo. Okay? Let's say for example, ang nursing intervention mo for pain is to provide diversional activities. So ano ba yung mga diversional activities? Kapag bata, pwede mong bigyan ng laruan. Pero kapag matanda, ang bigay mo sa kanya, dyaryo. Di ba? So yun yung sinasabi. Consider the age, the growth, and the development of the client. So what are the important data? So number one, of course, you need to know the name of the patient. Ayan. So that you can address him properly. Okay? Magandang umaga po, Ma'am March. Magandang umaga po, Ma'am Mela. Okay? So that you can address them properly. And then the age. Why? Because the age will affect either the manifestation and even your nursing care plan. Same thing with gender and your admitting diagnosis. Anong admitting diagnosis? Ito yung ano ba ang diagnosis sa pasyente mo? Okay? Then advanced directive, ano ba yung advanced directive? Ito yung meron bang ibinilin ang pasyente. Let's say for example, dumating sa point na kailangan siyang i-CPR. Sinabi ba ng pasyente kapag dumating yung point, bawal siyang i-CPR. Okay? And then you have your laboratory data and your diagnostic test. Bakit importante yung lab data? Because this will help you. These are supplemental information sa pasyente mo. Okay? Then medications, ano bang currently iniinom niya? Okay, meron ba siyang maintenance? O meron na ba siyang ininom bago siya ma-admit or bago siya pumunta ng hospital? Then allergies, okay? Let's say for example, meron ba siyang allergy sa gamot, allergy sa pagkain, okay? Then support services, meron ba siyang other agency? Then psychosocial and cultural assessment. Bakit importante yung cultural and your psychosocial? Remember, meron tayong kanyang-kanyang practices. Let's say for example, if your patient is Jehovah's Witness, okay, di ba? Bawal yan mag-blood transfusion. If your patient is a Muslim, I think they also have their separate practices. Or if your patient is not Filipino, okay? And the emotional state ng pasyente mo. Because the emotional state will help you in achieving your nursing diagnosis. Sir, bakit po? Let's say for example, gumawa ka ng nursing diagnosis pero yung emotional state pala ng pasyente mo hindi ganun ka-okay or hindi ganun ka-steady or ka-stable. Okay? So, yun. Then we have also the vital signs. Diba? The vital signs is your first data that will help you, give you data based on how good yung health ng pasyente mo. Okay? Then you have your height and weight. Then your review of system. Ano yung review of system? Ito yung elimination. Okay, ito yung sleep and pattern niya. Ito yung nutrition niya. Ito yung psychological niya. Okay? Then you have your standardized risk assessment. Pressure ulcer, false NDVT. The pressure ulcer is very, very, very common for foreign. Why? Kasi actually, pwede ka nga mademanda doon kapag nagkaroon ng pressure ulcer ang pasyente mo. Why? Kasi considered yun as negligence on the part of the nurse. Kasi ibig sabihin, hindi mo ginawa yung trabaho mo. Okay? So ito daw yung kinukuha kapag nagkumukuha ka ng client history. Number one, your physical and developmental. The intellectual aspect of the patient. Let's say, for example, the intellectual performance, the problem solving, the education level. Bakit napaka-importante ito? Kasi doon mo malalaman is how well your patient can participate or how well your patient can understand your health teaching or your instruction. Okay? Then you also have your spiritual. Let's say, for example, sabi ko nga kanina, yung Muslim and even yung Jehovah's Witness. Okay? Yan. Then you need to consider the emotional pattern. Why? Gaano ba ka-stable yung emotional pattern niya? Kasi baka naman, ang ganda-ganda ng nursing care plan mo tapos hindi naman pala stable yung kanyang emotional pattern. Okay? Then you also have your social status. Let's say, for example, the financial status, okay, the cultural role, the cultural influences, the recreation activities. Okay, so these are the data that you need to collect when you are doing your client health history as part of your assessment. So organizing assessment data. Okay, so bakit ba kailangan i-organize yung data? Because this will help you on what or which problem you're going to prioritize first. Okay, so cluster the data into groups according to a nursing or medical model. So you can use your Maslow hierarchy. Very common ang Maslow hierarchy sa pag-justify kung anong gusto mo unang nursing diagnosis na i-prioritize. Okay? Then clustering data helps maintain a nursing focus, allow patterns to be recognized. So let's say, for example, alin dito sa data mo ang other physiological? Or alin sa data mo ang under safety? Or alin dito sa data mo ang other emotional? Okay? Then cluster by body system or by need deficit. So when you say body system, alin ba dito sa assessment ang affected is about heart? Okay? Or alin ba dito sa assessment ko is focus on the fluid. Okay? Then helps to identify nursing diagnosis pertinent to your client. Okay? Again, nursing diagnosis pertinent to your client. Okay? So for example, for this one, all information about nutritional status, okay, will help you to identify the nutritional alteration. So ibig sabihin, nung cluster mo yung mga assessment mo, nakita mo na marami kang issues about the nutritional status of your patient. And this will guide you na ang problema na or pwedeng nursing diagnosis na pwede mong ibigay sa pasyente is about the nutrition of the patient or the client. Okay? So again, if you're going to utilize the Maslow hierarchy, so the first, let's say for example, cluster mo na yung mga nakuha mong assessment. Okay? Tapos nakita mo na mas marami yung under ng physiological. So ibig sabihin, this will be your first nursing diagnosis. Okay? And this will be your second nursing diagnosis, third, fourth, and fifth. Okay? Sir, sorry po, hindi ko po maintindihan. Okay? Assuming, let's say, for example, sinabi ng pasyente mo, okay, nahihirapan akong huminga. Okay? Tapos sinabi rin ng pasyente mo, namimiss ko na umuwi sa amin. Okay? Saan ba nagpo-fall ang nahihirapan huminga? Nasa physiological. Kaya ito yung first nursing diagnosis mo. Okay? Saan ba na-fall yung namimiss ko na po yung bahay? Nandito siya love and belonging. Kaya mangyayari, that will be your second nursing diagnosis lang. Nakuha? So you can use your Maslow hierarchy to help you identify which nursing diagnosis you need to prioritize first. Okay? Pwede rin naman yung principle of ABC. Sir, ano yung ABC? Okay? ABC. This is your airway, your breathing, and your clearance. Okay? So let's say for example, ginamit mo ABC. Okay? Kunyari nakita mo yung pasyente may sugat. Nahirapan siyang huminga. Anong unahin mo? Siyempre yung airway. Okay? So yun. So you can use either the principle of ABC or your Maslow hierarchy. Okay? In prioritizing your nursing diagnosis. Okay? So the next step is diagnosis. Okay? So any question po about assessment before we proceed sa diagnosis? Any question po? You can use the chat box po if you have any question po about assessment. Okay, can I see thumbs up po kung wala pong tanong about the assessment po? I think wala. Yan. Thank you po sa thumbs up. Okay, so the second step is diagnosis. Ang sabi nga natin kanina, di ba? Systematic. Okay, systematic ang ating uh, nursing diagnosis. Nursing process. So tapos ka na sa assessment, na common na yung data. So from that data na cluster mo na, then you can create your nursing diagnosis. Okay, so after assessment, okay, you will apply your critical thinking so that you can identify your diagnosis or your problem identification. Okay. So law and standards continue to change to reflect how nursing practice is growing. And that is your APN role. What is APN role? This is your practical nursing. Okay? Sa Pilipinas, wala tayong ganito. Sa ibang bansa lang. Novice nurses responsible for recognizing health problems, anticipating complication, and initiating action to ensure appropriate and timely. Sino ito yung mga novice nurses? Yung mga baguhang nurses. Ito yung mga beginner nurse pa lang. Okay, so commonly, ito yung mga nasa bedside. Yeah. So how to identify nursing diagnosis? Okay. So first, there should be a common language for nurses. So hindi pwedeng kung ano yung orientation mo, yun ang gagamitin mong language. Hindi pwede. We need to consider the language being used by the hospital. Okay? So para at least hindi rin confusing sa ibang nurses. Nagkakaroon kayo ng uniformity regarding with the communication. Nasa same boat kayo or nasa same length kayo. Okay? Then a clinical judgment about an individual, family, or community response to an actual or potential health problem. Okay? So dito, sa nursing diagnosis niya, dalawa lang ang sinabi niya. You have your actual and you have your potential. So when you say actual, this is the existing problem. Okay? Existing. And your potential, this is your risk. Okay? Nursing diagnosis provide a basis for selection of nursing intervention. Okay? So sabi ko nga kanina, okay, so magandang assessment mo. So dahil doon sa assessment, makakagawa ka ng magandang nursing diagnosis. Okay? Ngayon, tapos ka na sa nursing diagnosis. Ang tanong doon, ano ang goal mo? Okay? Or ano ang target outcome mo sa pasyente mo? Mabalik tayo ulit sa fever. Okay? So na-identify mo, mainit siya, mataas ang kanyang temperature. Okay? Namumula siya, warm to touch siya. Okay? So ang nursing diagnosis mo ay hyperthermia. So kapag nalaman mo na, ng nursing diagnosis ng hyperthermia, definitely ang goal mo is to lower the temperature. And kung malinaw na sa'yo na ang goal mo ay mapababa ang temperature, so dapat ang intervention mo are anchored or directed to your goal. Okay? Again, once you identified your nursing diagnosis, okay, because your nursing diagnosis, that is your problem, tama? So ang planning mo is opposite of your nursing diagnosis. Nakuha? Let's say for example, ang nursing diagnosis mo ay hyperthermia. So ang planning natin should be opposite of your nursing diagnosis. Ano yung opposite ng hyperthermia? Is to lower down your temperature. Nakuha? O let's say for example, nagtataing pasyente mo. Ang nursing diagnosis mo ay altered bowel elimination. So ang planning mo is opposite of your planning. So dapat ma-normalize. Tama? And once you identify your goal, you try to identify your nursing intervention that are anchor or that will meet your identified goal or outcome. Okay? Then sabi dito, none the list of acceptable diagnoses are updated every 2 years. I'm not sure lang when was the last time na nag-update sila. Okay? Then diagnostic reasoning. So apply critical thinking to a problem identification. So again, lagi itong sinasabi na critical thinking is very important for a nurse. Okay? That requires knowledge, skills, and experience. Bakit knowledge? Okay, so ito yung mga bagay-bagay na natututunan nyo sa eskwelahan. Tama? Ito yun. And ito yung bagay na matututunan nyo kapag nasa bedside na kayo and kapag nurse na kayo. And of course, the nurse should consider the big picture. Ayan. Ano, sir, ano po yung big picture? Baka naman kasi ang lagnat is not about, it's not simple lagnat, it's about complication na pala, or it's about manifestation na, or it's a pathological problem na. So when you say pathological problem, this is because of your underlying condition. Nakuha? Yeah. So fundamentals principle of diagnostic reasoning. So first, recognize your diagnosis. Okay. Then you keep an open mind. Ano yung open mind? Okay. So sabi nga, gamitin mo yung knowledge mo, gamitin mo yung skills mo, gamitin mo yung experience mo. At you can also consult your literature. Okay, your related literature. Then backup diagnosis with evidence. Ano yung evidence? Let's say for example, hyperthermia related to inflammatory process as manifested by increase in temperature. Okay, because it will support your identified diagnosis. The intuition is a valuable tool for problem identification. Ano yung intuition? Ito yung, anong Tagalog ng intuition? Palagay?
Kutob, sir. Kutob.
Kutob. Yeah, sorry,
Kutob,
kutob.
ayun.
Yan, kutob. Yan.
Intuition ng mga babae sa mga asawa nila at boyfriend. Okay, no
Tama.
kutuban.
So minsan ang intuition mo ay ano, 'di ba? There's a scientific reason bakit ka kinukutuban, 'di ba? Then independent thinker. Ayan. So bakit independent thinker? Kasi unang-una, ikaw yung nurse na nakakakita dun sa problema ng pasyente. Then know your qualification and limitations. This is very important. Bakit? Kasi doon mo malalaman gaano ba kalalim. Okay? Ang iyong understanding dun sa case ng pasyente. Ayan. The nursing diagnosis, so you have your actual, again, and you have your potential. Sabi nga natin sa actual, this is your existing problem. Okay? And your potential, these are your risk factor. Ayan. So actual, these are the actual evidence or the signs symptoms. So let's say for example, this is your fluid volume deficit. So ibig sabihin, ang pasyente mo ay either dehydrated. Okay? So commonly, this is because of either vomiting, nagtatai siya. Ayan. Okay? And then you also have your potential. So when you say potential, these are the foreseeable or the possible. Okay? So for example, client's database contain risk factors of diagnosis but not true evidence. Let's say for example, risk for altered skin integrity. Ayan. Sir, kapag ba sinabing risk, dapat ba meron kang cues? Okay? Yun lagi ang yun lagi ang tawag dito?
Ano?
Ang tanong. Yan. Sir, pag ba sinabing risk, dapat ba meron bang manifestation? Pwede. But that manifestation should support na there's a possible problem. Not to contradict your identified diagnosis. Let's say for example, kanina nag-express kami. Okay? Ang identified problem nila is risk for infection. Pero ang nakalagay sa cues, mataas na yung temperature, mataas na yung WBC niya, meron na siyang pus. Okay? So kinontradict niya yung risk for infection. Why? Kasi yung cues mo, ang cues mo, sinasabi, meron ka ng infection. Pero ang nilagay mo, risk for infection. So anong pwede mong ilagay? Pwedeng wala siyang knowledge about how to properly care. Okay? So those are the things that you can include. So writing and nursing diagnosis. So you have your actual problem. So when you say actual problem, this is your identified problem. Okay? This is your identified problem and the etiology. Okay? So usually problem and then your related factor. Okay? Then you have your etiology and then you have your evidences. Anong evidences? Ito yung signs and symptoms. So let's say for example, hyperthermia related to inflammatory process as manifested by increase in temperature. Okay, so or ineffective airway clearance related to increased mucus production as evidenced by positive crackle sound. Okay, or fluid volume deficit related to increased fluid loss as manifested by bowel movement. Okay, so yun. So you try to connect your problem kung saan ba Ano ba ang nagdudulot doon? Okay? So for example, ito, impaired communication related to language barrier as evidenced by inability to speak English. So at least malalaman mo na ang problema pala ay ah, yung means of communication. Okay? Kasi pag nalaman mo na ito yung problema, then you can generate a more appropriate planning and a more factual and relevant intervention. Kasi pag hindi mo na-identified itong saan ba related ang problem, doon ka magkakaproblema. Naku ha? Let's say for example, impaired communication related to unknown, 'di ba? Anong ilalagay mong planning? Anong ilalagay mong intervention? Okay? But for this one, alam mo na meron siyang impaired communication, okay? Kasi merong language barrier. Okay, let's say for example, uh, na-admit ang isang Pinoy sa Norway. Okay? So hindi sila makapag-communicate. Why? Kasi hindi marunong mag hindi ganito na lang. Ang Pinoy na-admit sa Japan. So hindi marunong mag-Nihongo ang pasyente. Okay? Yung mga nurse hindi marunong mag-Pinoy. Okay? So doon mo malalaman kung anong kailangan mong gawing planning and even intervention. Okay? So ganun kaya importante yung kailangan mo ma-identify yung etiology. Okay? So again, once you identify your problem, you try to identify ano ang cause. Okay? Because it will help you identify what specific goal you want to attain and what relevant intervention you're going to perform. Okay? So we have the potential or risk problem. So again, your identified problem and your etiology. Okay, it can be manifested by the risk factor. So risk for impaired skin integrity related to obesity or excessive diaparesis and immobility. Ano sabi natin last time? Kapag nag-identify ka ng nursing diagnosis, make sure you're not also liable. Okay, yung hindi ka madidemanda. Okay? Hindi pwedeng risk for impaired skin integrity related to failure of the nurse to turn the patient side to side. Hindi pwedeng ganun. Okay? Or risk for impaired skin integrity related to decreased muscle strength. Ayan. Ibig sabihin, hindi nakagalaw ang pasyente kasi mahina ang pasyente. Okay? So when you are creating your nursing diagnosis, make sure you will not be held liable. Okay, di ba? Sabi natin, lahat ng sinulat mo sa pasyente or sa chart, it either will protect you or it will damage you, okay, or break you. Ayan. So use accepted qualifying terms. Let's say for example, alter, decrease, or increase, or impaired. We don't use medical diagnosis. Tama? Kasi kapag nilagay mo medical diagnosis, then that is a medical problem that needs medical attention. Ayan. Kasi meron namang medical problem na you can convert into a nursing diagnosis. Let's say for example, fever. You can use hyperthermia. Instead na diarrhea, you can use altered bowel elimination. Instead na sinabi mong dehydration, you can use fluid volume deficit. Instead na sabihin mong pneumonia, pwedeng ineffective airway clearance. Kapag sinabi mong asthma, pwedeng impaired gas exchange. Okay, so merong katumbas ang medical diagnosis sa nursing diagnosis. Okay, don't state two separate problems in one diagnosis. Okay, di ba sabi ko nga kanina, sometimes when we cluster our assessment, doon mo marirealize na, oh, ang dami yung problema. Okay, so bawal ilagay lahat ang assessment under one umbrella, especially if they are not related to each other. Okay? Then refer to NANDA for NANDA list in nursing textbooks. So, planning. So, tapos na tayo sa assessment, tapos na tayo sa diagnosis. Okay, so any question po about diagnosis? Can I see thumbs up po? Kung malinaw. Yan. Thank you, Ben Consejo. Yan, salamat po. Okay, so let's proceed with the planning. Okay, so assessment and diagnosis. Tapos ka na sa assessment, nakapag-create ka na ng diagnosis mo, na-identify mo kung anong problem at anong cause niya. Okay, then proceed ka na sa planning. And this is your goal. Okay, this is your creating your goal or your target outcome. Okay, so set your priorities of care, what needed to be done first or what can wait. Sir, again, paano mo malalaman? Paano ka magpa-prioritize? Di ba ang sabi ko nga kanina, you can use your Maslow or your ABC. Yan. The principle of ABC. Yan. Then apply the nursing standard. Let's say, for example, Practice Act, Nursing Practical Guidelines, Hospital Policy, and Procedure Manuals. Okay, because sometimes it vary from hospital to hospital, especially if they are international accredited. Ayan. Then identify your goals and outcomes, derive them from nursing diagnosis. Ito yung sinasabi ko kanina. Once you identify your nursing diagnosis, your planning or your outcome is opposite. Yan. Opposite. Okay? Opposite of your nursing diagnosis. Okay? Ulitin ko, sir, paano po yun? Kapag mataas ang fever, ang planning mo, pababaan. Kapag nagtatae siya, ang planning mo, mabawasan yung pagtatae niya. Kung ang nursing diagnosis mo, nahirapan siyang huminga, ang planning mo ay mapabuti ang kanyang paghinga. So your planning is opposite of your identified nursing diagnosis. Okay? Kapag actual. Okay? Then determine intervention based on the goal. So ito yung sinasabi ko, that the intervention should be relevant. Okay? Bawal yung MEMA. Yung MEMA isulat ka lang para humaba yung NCP mo. Okay? Your intervention should be relevant. Okay? Dapat directed siya sa pag-meet ng goal mo. Okay? So balikan natin yung fever. Ang fever mo, ang goal mo is to lower down temperature. So therefore, ang intervention ko are perform TSB, increase oral fluid intake, provide cooling environment, remove excess clothing, encourage patient to rest. Okay? Yung bang mga identified intervention ko, directed dun sa goal ko? Yes. Okay? So, hindi pwedeng fever ang problem mo. Tapos, ang nalagay mo intervention is provide small frequent feeding. Okay? Or provide back tapping. Okay? Directed ba yun sa goal mo? Hindi. So, bawal yung ganun. Dapat ang ilalagay mo lang na intervention are those intervention that will help you to meet your outcome, your target outcome. And then record the plan or document the plan. Yeah. Okay. So let's say, for example, for this one, risk for impaired skin integrity related to immobility. Okay. Then, okay. So, ang problema niya ay risk for impaired skin integrity. Okay? Then, ang causative niya is because immobile, hindi makagalaw yung pasyente. Okay? Baka as evidences by decreased muscle strength, pwede yan. Okay? So therefore, ang planning mo, the patient will have no signs of skin breakdown. Okay? This is the opposite of your nursing diagnosis. Okay? Then the outcome needs to be time related. So you need your planning should be smart. Ano yung smart? It should be specific, measurable, attainable, realistic, and time-bound. So when you say specific, ibig sabihin absence of skin sores. Okay? When you say measurable, let's say for example, zero. Okay, zero manifestation. When you say attainable, kaya ba? Kaya ba ng nurse? And realistic ba siya? And time-bound. Gano'ng katagal mong plano gawin to? 4 hours ba? 8 days ba? Or 1 week ba? Okay? So you have your short-term versus long-term goal. Okay? Sir, bakit kailangan na merong short-term and long-term? Okay? So imagine kung ang problema ng patient mo is about airway, nahirapan siyang huminga. Okay? Nahirapan siyang huminga, meron siyang difficulty of breathing. So dapat ang short-term goal mo kaagad ay may improve ang kanyang breathing pattern. So ano yun? Pwedeng hours lang or pwedeng minutes lang. Depende how severe or how serious the case of the patient. And then you also have your long-term goal. Okay? The short-term goal can be achieved in reasonable amount of time. It can be few hours or to few days, depends on your identified nursing diagnosis. Okay? Then long-term goal maybe take few weeks or months to be achieved. Let's say for example, kung rehabilitation. Yeah. Ayan. So kapag rehabilitation, of course, hindi mo ito makukuha ng oras lang or araw. This can be weeks or months. Okay? Then client will ambulate down to the hall within 2 days. Tama or mali? Tama, because you don't expect a person na maglalakad na siya after an hour lang. Then client will walk the length of the hallway independently by the end of 2 weeks. Okay? So kung makikita mo, nilagay niya dito, client will ambulate down the hall lang. Okay? In 2 days lang. Pero pagdating sa long-term goal, ang gusto niya, makalakad siya ng mas mahaba at saka independent. Okay? So anong time frame niya? 2 weeks yun. Nakuha? Okay? Let's say for example, your patient also have infection. Okay? Tapos mataas yung fever niya. Hindi mo naman pwedeng i-normalize yung fever niya within the day, especially if it's about infection. Di ba? It should be part of your long-term goal. Ma-normalize yung temperature niya. Ano ang magiging short-term goal mo? Ang short-term goal mo, ma-lower down yung kanyang temperature. Okay? Malinaw? Then achieving goals and outcomes. So be realistic in setting goals. Wag kang bida-bida. Okay? Gusto mo, let's say for example, temperature, tapos nilagay mo, short-term goal, normal na kaagad yung temperature. Ang cause pala ng temperature, ang cause pala ng increase in temperature niya is about pathologic or dahil sa secondary because of the condition niya. Meron pala siyang infection. Is that possible? Hindi siya possible. Okay? Ang pwede mong gawin, short-term goal lang. Lower down lang yung temperature or hindi na siya tataas. Then set goals mutually with the client. Sir, bakit napaka-importante ang mutually with the client? Why? Kasi may mga intervention ka na kailangan mo ng participation niya. At remember, your patient have the right to refuse whatever your no matter how good your intention is. Then, goals should be measurable. Use measurable, observable verbs. Let's say, for example, patient level of pain will be lessened from 9 to 7. Okay, so measurable yon. Or patient temperature from 30.5 to 37.9. That is measurable. Di ba? Then identify one behavior per outcome. Let's say, for example, patient will be able to, patient will adapt, okay, the health teaching provided, such as, yan. And when indicated, use short-term versus long-term goal. Yan. So usually sa atin, ang ginagawa natin, we ask the student to identify short-term and also long-term goal. Okay, so ito yung sinasabi ko kanina. Kapag gumawa ka ng planning mo, it should be specific. Ano ba talagang gusto mo? Ayan. Then measurable. Then attainable. Realistic and time-bound. Parang kayo, sir, gusto ko po maging RN. Yan. Di ba? That is specific. Measurable. Okay? Gusto ko pong maging RN in 4 years. Ayan. Attainable ba yon? Yes. Realistic ba yon? Yes. Time-bounded. Lagay natin 4 years and 0.5. Yan. Kasi magtitake pa kayo ng board exam. Yan. Di ba? So this is specific planning. Yan. Gusto ko maging RN po sa 4 na taon at maging licensed nurse po ako after kung graduate. Yan. Same thing with this one. Lower down temperature. Okay? From 38 to 37.5, 0.7. Yan. Is it attainable? Okay. Kapag sinabing yes, kapag yes, edi go. Is it realistic? Then kapag time-bound, ibig sabihin within 3 hours. Okay? Patient temperature will be lessened from 38 to 37.7 within 3 hours. Or after 3 hours, patient temperature will lessen or will decrease from 38 to 37.7. Okay? Yun. So yun yung planning. Okay? So any questions about assessment, diagnosis, and planning? Malinaw po tayo sa assessment, diagnosis, and planning. Can I see thumbs up po again, please? Ayan. Thank you po sa thumbs up. Yan. So let's proceed with the intervention. Ang sabi natin kanina, di ba, ang goal mo is opposite of your identified problem. Bakit? Kasi kung mataas ang temperature niya, ang planning mo ay mapababa. And your intervention should be relevant and anchored doon sa in-identify mong outcome or planning. Okay? So nursing intervention are actions performed to reach the goal or the outcome. So ibig sabihin, this should be direct, and related, and relevant dun sa identified outcome mo or planning. Okay, bawal ang MEMA. MEMA ay lagay ka lang. Okay? Then monitor health status. Ito yung sinasabi ko na even though you are on the intervention phase, still you can perform your assessment phase. Okay? Then minimize client risk. Then direct care intervention. So direct action performed to client. Let's say for example, inserting Foley catheter. Okay? Then you also have your indirect care intervention. However, uh, very important yung direct care. Ayan. So lagi mong bibilangin. Okay? Ilan na ba yung actual na intervention ko para ma-meet ko yung planning ko? Okay? Because sometimes your indirect care cannot really help you in lowering or in meeting your goal. Nakakabigay lang sila ng information but it's not actually an actual intervention. So anong ibig kong sabihin? Let's say for example, ang problem mo is fever. Balikan natin si fever. Tapos ang nursing intervention mo ay monitor temperature. Okay? Then ang pangalawang intervention mo ay perform TSB. Sir, question. Pareho ba silang intervention? Yes. Pareho ba silang independent intervention? Yes. Okay? Pero sir, alin ba dun sa dalawa ang nakaka-lower ba ng temperature? Is it monitor the temperature or the laboratory? Or is it performing TSB? Yung perform TSB. Tama? So lagi mong bibilangin, okay, if you have enough direct action na para ma-meet mo yung outcome mo. Because sometimes ang laging mali ng nurse, ang dami niyang intervention pero puro assessment lang or puro indirect lang. Yes, tama. That is part of your intervention. However, hindi siya outcome oriented. Okay? Nakuha? Yeah. Then interventions will either be collaborative, combining nursing actions and physician order. Okay, so let's say for example, these are the things that you need the advice of the doctor. Okay. Okay, so example, ineffective airway clearance related to incisional pain. Incisional pain. The nursing action first is to auscultate breath sounds. Okay? Direct action po ba to? No. Kasi this is only assessment. This is only monitoring. Assist with coughing and deep breathing every hour. Okay, direct action ba to? Yes. Why? Because it will help you to improve the airway clearance of the patient. Okay? So ulitin ko, kapag gumagawa kayo ng NCP, bilangin nyo yung actual intervention nyo kung tama na ba yon para ma-meet nyo yung planning nyo. Kasi baka naman marami kayong nalagay na intervention pero commonly, pure monitoring lang sila or pure assessment lang sila. Okay? So implementation, putting your plan into action. Definitely hindi mo lang dapat isulat. Okay? Dapat gawin mo lahat ng mga nilagay mo doon. Tama? If hindi mo sinulat, hindi mo ginawa. At kung sinulat mo, dapat gawin mo. Yun lang yung logic doon. Then set priorities after report, especially if you need to report it to the doctor. Then assess and reassess. Diba? Ito yung sinabi ko kanina. Even though your assessment is your first phase, still even though kahit nasa implementation ka na, you need to assess again. Why? Because you want to know if your intervention are effective. Okay? Then perform intervention. Then chart client responses. Ano yung chart client responses? Let's say for example, bumababa yung temperature niya. Okay? Nag-improve ba yung breathing pattern niya? Okay? Then i-endorse mo yun sa next shift. Kasi para malaman niya kung kailangan niya bang gawin yun or i-continuous na gawin yun or kailangan na ba niyang stop. Okay? Okay. So, describe a category of nursing behavior in which the actions necessary for achieving the goals and outcomes are initiated and completed. Okay, so then actions taken by the nurse. So what are the types of nursing intervention? So first, we have the protocol. Okay, these are the written plan specifying the procedure to be followed during the care of client with select clinical condition. This is a very good example. If you have your HIS. Sir, ano po yung HIS? And you have your EMR. Yan. Yan. Sir, ano po yung HIS tsaka EMR? Ito yung mga computer generated. Okay? So ibig sabihin meron na siyang ready information. Okay? So let's say for example, in-enter mo yung data ng pasyente. Magre-recommend na yung system kung what are the intervention na kailangan mong gawin. Okay? Then you also have your standing orders. So these are the document containing orders for the conduct of routine therapies, monitoring guidelines, and or diagnostic procedure for specific. Let's say for example, your patient have fever. Okay? So definitely your patient will undergo laboratory treatment. Okay? Pwede lalagyan din siya ng IVF. Okay? So those are the standing orders. Ibig sabihin kapag standing order, these are consistent. Okay? These are fixed. Fixed to. Fixed. Kaya siya tinawag ng standing, nakatayo. Naka-standby na siya. Yan. Sorry. Yan. Standby is the tamang term. Standby. Yan. So kapag may dumating na pasyente, ito na yung gagawin mo sa kanya. Okay? So, implementation process involve reassessing the client. Again, why? What is the purpose of reassessing? Because you want to make sure that your identified intervention are effective and are correct based from the identified nursing diagnosis. Ayan. Sir, meron po bang time na kailangan baguhin yung NCP? Pwede. Kasi lalo na kapag nag-progress yung patient, or let's say for example, nag-iba ang naramdaman ng pasyente. Okay. So pwede ma-revise yung NCP along the way. Ayan. Then reviewing and revising the existing care plan. So ito yung sinasabi ko kanina. Kasi baka naman kailangan mong i-revise yung nursing diagnosis mo o kailangan mong baguhin yung planning mo. Okay? Then organizing resources and care of delivery. Such as equipment, personnel, tsaka environment. Personnel is very important nowadays. Why? Kasi kulang ang ating healthcare workers because of your COVID. Ayan. And same thing with the equipment. Ayan. Last one, evaluation. Okay? So any question po about assessment, diagnosis, planning, and implementation? Can I see thumbs up po again? Yan. Thank you, Go. Yan. So evaluation. So ano yung ina-evaluate mo? Ina-evaluate mo yung in-identified mong planning. Okay? So let's say for example, fever, di ba? Ang sinabi nating planning, after 2 hours, patient temperature will decrease from 38.5 to 37.9. So i-evaluate mo yung planning mo. Okay? Goal met. Patient temperature decrease from 38.5 to 37.7. Or goal partially met kasi hindi siya ganun bumaba. Or goal not met. Okay, sir, kapag goal not met, okay, or goal partially met, okay, sir, ano bang purpose ng goal met? Okay, or goal partially met, or goal not met? Ano bang purpose itong tatlo? Kasi doon mo malalaman kapag kailangan mo nang itigil yung nursing care plan mo or kung kailangan mo na i-terminate. Tama? Kasi kung goal met na pala yan, bakit mo pagagawin yan na goal met ka na pala? Okay? Or kapag goal partially met, baka kailangan mong balikan yung assessment mo. Meron kang na-miss out. At kapag goal not met, then baka kailangan mong i-revise ang nursing care plan mo. Diba? So, yun ang purpose nung evaluation mo. Yan. So, evaluation of individual plan of care includes determining the outcomes achievement. So, ito yung goal not met, goal partially met, and goal met. Okay? Then, identify variables, factors affecting outcome achievement. So, ano ba mga naka-limit sa'yo para ma-meet mo yung desired outcome mo? Okay? Then decide where to continue or modify or terminate. Paano mo malaman? Kasi kailangan mong i-evaluate. Kapag kailangan mo i-continue, i-modify, or i-terminate. Okay? Baka kailangan mong i-revisit yung assessment mo, yung diagnosis mo, your planning mo, at kailangan mong dagdagan yung intervention mo. Okay? Then continue or modify or terminate plan based on whether the outcome has been met or partially or completely. So ito yung sinasabi ko. Let's say for example, goal met ka na pala. Then you need to terminate the nursing care plan na. Except if you need to keep that problem. Okay? Yan. So evaluation is a step of nursing process that measures the client response to nursing actions and the client progress towards achieving goals. So ito yung sinasabi ko kanina. Evaluate mo yung ginawa mong nursing intervention kung na-meet ba yung target planning mo. Okay? Then data collected on an ongoing basis and supports the basis of the usefulness and effectiveness of the nursing practice. Yeah. So evaluation of goal achievement. So we have to, diba sabi natin kanina sa planning, you have your SMART. There's specific, measurable, attainable, realistic, and time-bound. Okay? So it can be done by measures and sources. Ano yung measure and sources? Ito yung vital signs mo, Ito yung mga laboratory findings mo. Okay? So, yun yung mga measure and sources. Let's say, for example, from 30 na RR, naging 25. Okay? O from 95 na pulse rate, naging 80. Yan. Then, as goals are evaluated, adjustment of the care plans are made. So, anong ibig sabihin nito? Ito yung sinasabi ko kanina. If goal partially met, baka kailangan mong balikan yung assessment mo or yung diagnosis mo or yung planning mo. Or kailangan mong i-improve yung intervention mo. Mas lalo na, kapag goal not met ka, ibig sabihin there's something wrong. You need to reassess again your patient. Then, if the goal was met, then there is a chance that you need to discontinue or terminate the nursing process. And then redefine priorities. Yan. So when you say redefine, yan, baka naman nagbago na yung problema ng pasyente. Yan. And of course, thank you for listening. Yan. So balikan lang natin kanina yung case scenario bago tayo mag-lunch, okay? Yan. So sabi dito, Mr. Jones complains of his throat and mouth are dry. He's allowed to drink fluids, but he has almost nothing to drink all evening. He tells you he would like to drink, but he doesn't like water, especially the warm water in the pitcher. He also hates to bother the nurse. The nurse notes his oral mucosa is dry and cracked, and his urine output for the last shift is low. Okay? So ano yung mga nursing assessment natin dito? Ano mga cues natin dito? Ano mga important cues natin dito? Anyone? Ano mga
Kyla, sir. Kyla, can you answer?
Ano yung mga assessment natin dito? Ano yung mga cues natin?
You
Ma'am,
participate.
hi sir.
Yes.
Yes.
Yung ano po, complaints his throat and mouth are dry.
Is that subjective or objective?
Objective po.
Very good. So that is your subjective. So ano pa yung mga other assessment mo? Yan, si Arbo.
Sir, yung ano po, yung objective data po, yung output po ng urine niya is low po.
Very good. So, pwede ka rin maglagay ng measurement dito. Let's say for example, less than 30 cc na lang. Okay, so urine output, very good. Next po. Sorry, di ko makita yung chat box.
Wala mo. So,
Sir, ano po sir? Subjective po sir.
Sige po.
Sa ano po, he tells you he would like to drink but he doesn't like water po. Especially the warm water in the pitcher.
Yan. Anong tawag dyan? That is under your emotional state. Kasi di
Yes
ba,
po.
ayaw niya. Okay. Okay, other cues pa po?
Sir, objective po.
Objective po.
Yung sa oral mucosa is dry and cracked.
Okay, very good. So oral mucosa and your yan, dry and cracked. So meron pa tayong na-miss? Wala na.
okay na.
Okay. So ito na yung assessment natin. So let's proceed with the diagnosis. Ano ang possible diagnosis natin? Ano ang possible diagnosis?
Dehydrated.
That is medical term. Let's make it nursing term.
Lack of fluids.
Sino yun?
Sino yung sumagot?
Medino.
Yan. Lack of fluid. Tama po yun. Pero ayusin lang natin. Lack of fluid. So, pwedeng fluid volume deficit. Okay? Yan. Fluid volume deficit. Deficit.
Gagamitin natin yung ating Nanda.
Okay. Fluid volume deficit. Okay. Can we identify the cause?
Sir, kasi po hindi po siya umiinom. Ayaw niya po uminom ng water.
Yan. So, paano natin siya i-state as related factor? Pwede ba natin sabihin fluid preference?
Due to fluid preference.
Pwede ba? Yes or no? Pwede po ba?
Sagot kayo.
but doesn't like water, especially the warm water in the picture. Ayan. Focus lang tayo dito sa case natin, ha. So, anong pwede nating sabing related factor? Fluid volume deficit related to, pwede po ba yung fluid preference niya?
Yes po, sir. Pwede po.
Okay, good. So, pwede ba tayo maglagay ng evidences? So, fluid volume deficit related to fluid preferences as manifested by?
His urine output for the last shift is low.
Okay, very good. So, meron na tayong assessment, meron na tayong diagnosis. Let's proceed with the planning. And sabi natin, ang planning ay opposite of your nursing diagnosis. So, anyone? Planning po. Let's follow the SMART, specific, measurable, attainable, realistic, and time-bound. So, anyone who wants to try?
Sino ang magta-try?
Sabi natin, the planning is opposite of your identified problem. So, sabi natin, fluid volume deficit related to fluid preference as manifested by decreased urine output. Ayan. So, anyone po who wants to try with the planning?
Bawal na akong sumagot eh.
Sir,
Yes.
increase intake of fluids po.
Ayan. Ano tayo? Time measurable.
Sir, pwede po kaya yung to increase his urine output?
Pwede yan as evidences. Ayan. Okay, so paano natin mapapa-increase muna yung yung urine output niya? Tama po yung urine output, pwede mong gamitin yan as evidences. Kasi yan yung under ng measurement mo.
Ano po, to give him yung preferred preferred drink niya po kung warm or cold po para po ma-increase yung urine output.
Yan, so time bound mo. Ano ang time natin? Ano ang time? How many hours or minutes do you need para ma-meet mo yung planning na yan?
Maybe an hour po
Yeah.
or less than.
Okay, so after an hour, patient will offer or patient will have a preference or we comply or will understand, okay, or pwedeng will adapt or will select fluid options given by the nurse that will lead to increase urine output. Okay, so yun. So ang goal natin ay mabigyan ng option yung nurse, ay mabigyan ng option yung pasyente na uminom siya ng tubig para mag-increase ang kanyang urine output. Okay, so we have the assessment, we have the diagnosis, and we have the planning. So let's have intervention. So anyone, let's give one, please. Consider the planning po. Ang sabi natin po, magkaroon siya ng preference. So what will be our first intervention muna?
Anong gagawin nyo?
I-consider natin yung natin planning. Sabi natin, magbigay
Para
ng
ma-meet nyo yung plan nyo.
Anyone? Anyone po? What should be our first intervention muna? Yan, sige.
Yes, Harold.
By giving the patient options whether to drink water or sodas.
Yan. Or pwede mong sabihin sa kanya is you try to assess first. Okay? So what are the preference? Kasi 'di ba kailangan mo muna malaman kung anong preference ng pasyente mo. Yan. Okay po, tama po 'yun. Next intervention na pwede mong gawin? Next intervention po.
Give the patient 1 liter of his favorable drink.
Ano pag sinabi niya alak?
Bigyan mo ng beer.
Lagay lang natin helpful or therapeutic. Yan. Sige po. So anything else po? Okay, number 1, yung first intervention natin is to assess. Okay? Anong tawag doon? Direct or indirect?
Direct po.
Direct ba 'yon?
Indirect pala.
Indirect kasi 'di ba hindi naman siya naka-increase ng fluid intake.
Oh, assess mo pa lang eh.
Yes. So yung second, sabi niya, provide adequate fluid intake. Is that direct or indirect?
Direct po.
Direct, very good. Question, yung po ba ay makaka-increase na kaagad ng fluid ng urine output? Yes or no?
Yes po.
Enough na yon para ma-meet natin yung planning natin, yung identify planning? Enough na ba yon? Yan. Hindi pa enough, di ba? So ano pa pwede natin gawin? Pwede pa tayo mag-indirect. Let's say for example, provide health teaching. Okay? Importance of fluid. Pwede ka rin magbigay ng health teaching regarding dun sa ano bang cause ng fluid volume deficit, or what are the common signs of fluid volume deficit, or what are the importance of fluid. Okay? So pwede ka mag-augment ng health teaching. Okay? So pwede ka rin maglagay ng monitoring. Let's say for example, i-monitor mo yung skin integrity ng pasyente mo para malaman mo if gaano ba ka-severe ang kanyang dehydration. Okay? So yun. So pwede ka pa rin magdagdag. Okay? So evaluation po. So anyone, let's try to evaluate po yung kanina na planning natin. Considered ba tayo partially met or goal met dun sa mga sinabi nating intervention? Goal
Ano
met?
ba yung plan nila, sir? After 1 hour of the intervention, ma-meet na nila yung goal nila?
After 1 hour of nursing intervention, patient will be offered and adapt the fluid preference as manifested by increased urine output. Yeah. So ang evaluation po ba, goal met, goal partially met, or goal not met? Based dun sa mga sinabi nating intervention.
So yung evaluation niya, ipapattern nyo din dun sa plan nyo kung na-met nyo yun.
Pwede ba sabihin na met na tayo? Or partially met lang? What do you think?
Partially po.
Partially po.
Partially po.
Kasi hindi naman na-maintain yung fluid volume pa.
And very good. Kung
Okay.
partially met, do we need to revisit the assessment or our problem, or are we going to continue lang our nursing process?
Continue lang po para ma-maintain yung fluid volume.
Yes, so tama 'yon kasi we can continue na lang. Why? Kasi tama naman yung assessment natin, tama naman yung diagnosis natin, tama naman yung planning natin. Okay? Maybe we can
Identify mo naman yung problem.
identify naman. So i-maintain lang natin siya. Okay? So ganun po kapag gumawa po kayo ng nursing care plan. Okay?
Ano, parang sir, parang wag kang gagawa ng nursing care plan na ikakapahamak mo.
True.
Ang nursing care plan, hindi lahat galing sa libro or kung ano yung nalalaman mo. Yung na-assess mo sa patient. Kasi baka lagay ka ng lagay. At the end, hindi mo naman na-reach yung ano mo, yung goal mo. O, tatanong ka ng CI mo. Pag estudyante ka pa lang. Ka na pinauwi ni Ma'am Asuro sa OB ward kasi hindi mo ma-explain.
Yes, so yan. So
Okay.
any question po before we have our lunch?
May lesson pa tayo baka kala
Laboratories. Thank you. Even the laboratories or whatever the treatment or even the health teaching, okay, nandun lahat. Okay? And then the result of the client response. So usually ito yung mga progress notes natin. Yung progress notes nung nurse or yung progress note nung pasyente or yung developmental ng pasyente. So nandun lahat. So you need to document that one. Yeah. So what is the purpose of client's record? So number 1, this is the means of your communication. Okay. So ano ba yung di ba? Kapag nagra-rounds yung doctor, anong tinitignan? Di ba? Chart. Why? Kasi expected niya, nandun na lahat yung mga information. In-encode natin lahat ng mga information. Same thing with the other data coming from the other healthcare professionals. Let's say, for example, your med tech. Okay? Yung mga med tech mo, yung other therapies mo, like respiratory therapies. Okay? Yung mga, tawag ito? Yung ibang yung ibang member ng healthcare team, let's say for example, residente. So nandun lahat. So your chart will means of communication among the healthcare professional. So instead of tatanungin na ng doctor, anong ginawa mo sa nurse, so titingnan na lang yung chart. Okay? So second is a legal documentation. So ito yung sinasabi ko, that chart will either protect you or will break you. Ayan. Kasi 'di ba, let's say for example, dinimanda ka ng pasyente. Ayan. So yung chart your chart will protect you, especially if you document everything. Ayan. And then it can be used by research. However, if you're going to use the document of the patient for research purposes, then the patient should be aware na yun nagagamitin yung data niya. Why? Kasi remember, the main reason kung bakit pumunta ng hospital yung pasyente is because as a client or as a patient, but not as a respondent or as a participant for the research. Okay? Then we have the statistics. So provides statistical information that can be utilized for planning people's futures or need. This is very common nowadays because of your COVID. Yeah. Then education serve as an educational tool for students in health discipline, especially for future nurses like you. Yan. Kaya tayo merong tinatawag na comprehensive nursing process, and then you utilize the patient chart as your data or your information or your source of your information. Then we also have the audit and quality insurance. So bakit audit and quality insurance? Kasi 'di ba, ang sabi natin doon naka-record lahat doon. Okay? So nandun lahat yung patient response doon sa treatment na ginagawa mo. Okay? So nandun doon yung mga bagay-bagay na ginagawa mo sa pasyente. Sorry. Then 7, planning of client care. So provides data which entire health team uses the plan care for the patient. So this is your collaborative effort. And then last one, the reimbursement. So, okay? Especially if your patient have, aside from the PhilHealth, meron siyang mga other health card. Sa ibang bansa, meron silang tinatawag na, nakalimutan ko na tawag na insurance doon, pero they have exclusive insurance like the PhilHealth. Okay? So, yun din yung importante. Ayan, reimbursement. Ayan. So, what are the different types of medical record or kung ano-ano ba ang nakikita mo sa medical record? So when you say medical record, these are patients' data that has related to the medical information. Okay, so you have the patient identification, present complaint, informed consent, nursing history, family history, medical history. So kung makikita mo, lahat ng nandito mo is about healthcare professional. Okay. Yeah. And then you have the nursing record. So when you see nursing record, this is exclusively for us. Ayan, for nurses alone. Okay, so ano mga nandun? Admission nursing assessment, ano ba naging observe mo sa kanya? Your nursing care plan, this is either your FDAR, okay, or your SOPI. Okay, ito yung mga nursing chart nyo. You have your card access. Ano yung card access? Ito yung summary ng patient information. Let's say for example, anong pangalan ng pasyente, anong diagnosis niya, anong IVF niya, anong medication niya, anong diet niya, anong treatment niya, anong mga pending orders sa kanya. Okay? Then you have your pertinent information about the patient, but commonly nasa Cardex na rin yun. Then you have your medication, your daily treatment and records. Ano yung treatment and records? This is your IVF. Yeah. Your flow chart, this is your INO. Then graphic record, what is TPRB? This is your temperature, pulse, RR, and your BP. So this is your vital signs. Then fluid imbalance record, this includes your urine output, your medication, skin assessment, and progress notes. So kung makikita mo, itong types of nursing records, nurses lahat ang gumagawa. Nurses lahat ang nag-encode. Okay? So, we have this what we call legal and practice standards. So under the legal, remember, your patient have the options to refuse. Tama? So let's say for example, kung gusto mo siyang lagyan ng tubo sa ilong pero ayaw niya. So wag mong ipilit kasi kapag pinilit mo, pwede kanyang idemanda. Okay? So make sure for those invasive procedure, you have informed consent. Kasi dun sa informed consent, you have 2 guidelines. Number 1, make sure your patient understand. Okay? Understand. Okay? And make sure your patient sign. Okay? Hindi pwedeng pumirma lang siya pero hindi niya naintindihan. Dapat naintindihan niya at pumirma siya. Nakuha? Kasi ang purpose ng informed consent mo is the willingness of your patient to participate, okay? Or to agree doon sa gagawin mong procedure sa kanya. Okay? So when you say informed consent means that the client understand the reasons and the risks of the proposed intervention. Like for example, yung mga nababakuna for COVID, di ba before tayo mabakuna, merong informed consent doon na anything that will happen, the municipal will not be held liable. Okay? So dapat bago ka pumirma, naintindihan mo. Kasi kapag pumirma ka lang, that is the downside. Okay? Then, witnessing confirms that the person who signs the consent is competent. So when you say competent, patient can able to read and understand and comprehend whatever is written on the informed consent. Okay? So elements of effective documentation. So use common vocabulary. Again, when you say common vocabulary, you need to consider the hospital policy also. Why? Kasi baka na mayroon silang sariling vocabulary or common terminologies that only applicable to that certain hospital. Then of course, write legibly. That is the main reason kung bakit hindi ako nag-apply sa Word. Kasi ayoko na nagsusulat. Okay, kaya nag-apply ako sa OR kasi konti lang yung charting doon. Kasi pangit ako magsulat. Okay? Then you have your abbreviation and symbol. So when you see abbreviations, again, we have approved abbreviation. However, there are some hospitals who are practicing their own abbreviation. Let's say, for example, SP. Ang SP sa iba is status post. Yan. Yung SO, pwedeng significant others. Okay? Pero sa iba, baka merong ibang meaning. Let's say, for example, hypertension. Sa ibang hospital, HPN. Sa ibang hospital naman is HTN. Okay? So, you need to be oriented what approved abbreviation meron sa facility. Organization, of course, you need to follow the let's say, for example, if you are doing a physical assessment or you're nursing charting, you need to do your cephalocaudal. Then accuracy, yun tama. Then documenting a medication error. Then confidentiality. So what is the difference between confidentiality and privacy? The privacy is the information being shared by the patient, and the act of keeping it private or between the two of you, that is your confidentiality. Okay? Kaya di ba kapag nagre-rep-dem tayo, sinasabi nyo na lahat po ng information na ibibigay nyo sa akin ay makakasiguro po kayo na mananatili po ito. Okay? Or hindi po makakalabas. So that is the act of keeping it private. That is your confidentiality. And then factual, yung makatotohanan. At it should be kompleto at current. Hindi pwede yung nag-charting ka tapos kahapon mo pala nagawa yan. Bawal yun. No. And then the organization of your data. Okay? Then elements of effective communication. So first, you have your use of common vocabulary. Sir, napaka-importante ng common vocabulary. Why? Kasi dapat lahat kayo nakakaintindi nung nilagay nyo doon. Hindi pwede ikaw lang. Okay? Then, improves communication and lessen the chance of misunderstanding between the members of the health team. Like for example, yung sabi ko nga sa inyo, ang iba, ang hypertension nila is HPN. Sa iba naman, HTN. Okay? So, yan. So, same case, pero different abbreviation. So, baka hindi kayo maging magka-muka. Okay? Then legibility. So when you say legibility, the print if necessary, do not erase or obliterate writing. So when you say do not erase, let's say for example, nagkamali ka. Okay, kunyari metronidazole 500 milligram. Ayan, TID. BID lang ba siya? So anong gagawin mo? Ayan, so you're going to put a line. Okay, and then you're going to countersign and then your date. Okay? So bawal yung gumagamit ka ng liquid paper. Ayan. Yung iba ang ginagawa nila, gumagamit sila ng scotch tape tapos dinidikit nila tapos inaangat para ma-erase or mawala yung sinusulat. Yung ibang nurse naman ang ginagamit nila yung tawag dito. Yun nga, yung scotch tape or yung plaster. And then state the reason for the error, then sign and date the correction. Ayan. So for example, for this one, client complains of pain. 6 on a 0 to 10 pain scale. When position on right hip. Ayan. So nagkamali siya. Ang ginawa niya, slash, mistaken entry, signature niya, and then date. Then nilagay niya left hip. Okay? So bawal mong burahin, bawal mong ganyanin. Okay? Bawal 'yan. Bawal din yung liquid paper, bawal po. Okay? So line lang doon sa above nung maling entry, then lagay mo mistaken entry, then your initial and the date. Okay? So abbreviation and symbol. So always refer to the facility approved listing. So sabi ko nga, facility approved listing. Even though we have our own abbreviation, sometimes the hospital has its own abbreviation, approved abbreviation. Then avoid abbreviation that can be misunderstood, especially kung ikaw lang may alam. Yan. Then organization, start every entry with the date and time. Let's say for example, kung nagbigay ka ng gamot, anong oras, anong araw. Okay? Especially kapag PRN yan. When you say PRN, that is your as needed, di ba? Then chart in chronological order, especially if you are doing your nurse's note. Lalo na kapag physical assessment. Ayan. Then chart medications immediately after administration. Then sign your name after each entry. Ayan. Sa ibang hospital, let's say for example, nag-order yung doctor, ang ginagawa ng ibang hospital, ang practice nila, nagka-countersign yung nurse sa gilid ng doctor's order para malaman na na-carried out na. Ayan. Then accuracy. So yung tama. Ayan. Use descriptive terms to chart exactly what was observed or done. So when you see descriptive, you were able to describe. Ayan. Yung ginawa mo sa kanya. Okay? Then use correct spelling and grammar. Sir, may grammar pala. Hindi ako marunong sa English. Ayan. Then write complete sentences. Okay? So bawal ang praise dito. Then document a medication error. So again, paano sabi natin? You put an underline, then put your initial and then your time and date. Okay? So document in nurse's progress notes, name and dosage of the medication, name of the practitioner who was notified the error, time of notification, nursing interventions or medical treatment, and client response to treatment. So very important na you're going to document and you're going to inform the charge nurse or the one that is in charge of you. Okay. Then confidentiality. Again, this is the act of keeping the information private. Okay. So sabi dito, the nurse is responsible for protecting the privacy and confidentiality of client's interaction, assessment, and care. Again, this is the act of keeping or act of secrecy. Ayan. Hindi pwede lang say for example, alam mo, yung artista na-admit sa amin. Naras pa siya. Yan, single pala siya. So bawal ganun, 'di ba? That is confident. You are breaching the confidentiality. Or let's say for example, sabihin mo, si senator ganyan na-admit sa amin positive for COVID. Yan. 'Di ba? So bawal yung ganyan. Kahit na kating-kati ka na ikwento mo, ayan, bawal 'yan. Lalo na kapag nagkwento ka sa elevator tapos may nakarinig sa yan. Bawal 'yan. Then factual, yung makatotohanan lang. So a factual record contains descriptive objective information about what a nurse sees, hears, feels, and smell. Anong naramdaman, anong nakita, anong naamoy sa pasyente. Then objective description is the result of the direct observation and measurement. So bawal yung sinabi lang. Okay? So you need to confirm. Let's say for example, sinabi ng pasyente na, nurse, ang baho ng dumi ko. Ayan. So bawal yun. Pwede mong ilagay yun sa subjective, pero you need to validate that one. Okay? Or nahirapan ako huminga, pero di naman pala siya nahirapan huminga. Ayan. Then complete. Ayan. The information within a recorded entry or record must be complete, containing appropriate and essential information. Ano dapat ang hindi lagi nawawala? It's your signature and the time and the date. Ayan. Kasi baka naman naglagay ka, di ka naglagay ng oras or araw or even your initial, then pwede na lang sabihin na hindi ikaw kahit na penmanship mo yon. Then current, anong ibig sabihin ng current? Time. Yan. Timely. Yan. Timely entries are essential in patient's ongoing care. So, delay in documentation leads to unsafe patient care. So, anong ibig sabihin nun? Let's say, for example, nagbigay ka na pala ng gamot pero di mo dinocument. Binigay ng susunod na nurse, di na double dose yung pasyente. Kawawa naman. Ayan. Then, health organization use military time. But in the Philippines, we are not using military time. We are using the standard time. So, ano yung military time? Ito yung 13, 14, 15, 16, 17. Sa atin, hindi. Yeah. So, following activities The nurse should enter timely the vital signs. Okay, bakit sir napaka-importante ng vital signs? Kasi 'di ba ito yung ano mo first data ng patient mo how healthy the person is. Then you have your pain assessment as your 6 vital signs. Then administration for medication, preparation for diagnostic, change in patient status, admission, and patient response. So, ito yung mga bagay-bagay na kailangan mong i-record or i-update yung data ng pasyente mo. Okay? So, let's say for example, yung pasyente mo for CBC siya. Okay? So, nagawa na pala, hindi mo binura or hindi mo in-update yung data or yung cardex mo. Di ba? Then organize, communicate information in a logical order. So hindi pwedeng kapag nag-endorse ka, nag-complain ka, sinabi mo sa kanya na masakit ang ulo ng pasyente tapos napunta ka sa paa. Hindi pwedeng ganun. So dapat it should be logical, especially with the flow. So sometimes when the patients when they are doing the reporting, they start first with the name, with the age, gender, anong diagnosis sa kanya, anong IVF, anong gamot. Ayan. So ibig sabihin in orderly manner. So what are the types of recording? So we have the patient's clinical record. So ito yung sinasabi na, of course, when you say patient clinical record, this is about the patient. And then when you say individual staff records, these are the data that being done by the nurses. And then we have the ward record. These are the information that are owned by the hospital, or I mean, a hospital form. Then we have the administrative records with educational value. Okay, so what are the common ward records? So you have your patient clinical records, staff attendance records, staff leave records. So kung makikita mo, itong mga form na to are hospital, okay, or institutionalized form. Yeah. Then methods of documentation, we have the narrative charting, source-oriented charting, problem-oriented charting, pie charting, focus charting, and so on. So we're going to discuss that one by one. Sa ibang hospital, especially in a foreign land, they have the computerized documentation na. Sir, paano ginagawa to? Nandun na yung mga information, you're just going to select lang or click lang kung ano applicable sa pasyente mo. Okay? But still, even though yung mga data nasa system na, kailangan mo pa rin ng critical thinking. Why? Kasi ikaw pa rin magde-decide what are you going to select. Okay? Doon sa ibibigay na information ng system. Okay? So we have what we call narrative charting. So when you see narrative charting, ito yung essay type, paragraph type. So doon lahat sinusulat mo. Okay? So narrative charting describes the client's status, intervention, and treatment. Response to treatments is in story format. Wala akong alam na hospital sa Manila na nagpa-practice ng narrative charting. Okay? Wala na akong nakikita. Ayan. So what are the 5 basic components of traditional client records? So you have your admission sheet as the first sheet that you can find in the patient chart, physician's order sheet, medical history, nurse's notes, and the special records. Okay? Then second, you have the source-oriented charting. Okay, so when you say source-oriented charting, may kanya-kanyang charting ang bawat departamento. Okay? Kaya tinawag na source. Okay, so each person or department makes notation in a separate sections on the client's chart. Okay, di ba? Medyo magulo. Ayan. Then narrative recording by each member of the healthcare team on a separate records. Then mostly traditional. So when you say traditional, these are usually narrative form. Then different discipline chart on separate form. Then each reader must consult various parts of the record to get a complete picture. So kaya siya tinatawag na source-oriented kasi it depends on the department who will be doing the charting. Okay? But commonly, it's a narrative form pa rin. Ang pagkakaiba lang, bawat department meron sa sariling area doon sa patient chart. Then we have the problem-oriented or your SOPI. Yan. Ito yung very common sa mga hospital or ito yung very common na pinapagawa ng mga schools sa mga student nurses. Kasi dito matatrain ka paano gawin yung ADPI mo. Diba? Kasi kung makikita mo, this is your ADPI. Your assessment, your plan, intervention, evaluation. Yan. So again, your problem-oriented, you have your subjective, what patient tells you or kung anong sinabi. Diba? S, sinabi. Then objective, anong na-observe mo, and then your assessment. Okay? So, what will be your diagnosis? Parang ganun. Then plan, what are you going to do? Then your intervention. So again, your intervention should be direct on the identified plan and problem. then evaluation, and then revision if needed. Okay, so yan. So marami pa sa Manila ang nagpapagawa ng SOPAI actually. Even yung mga hospital, yung mga schools ang pinapagawa nila sa estudyante ay SOPAI. Kasi this is equivalent to your ADPI. Yan. This is a nursing process mismo. Okay. Then we have the methods of documentation or your pie charting. This is your problem statement. So ito yung problem focus. And then your intervention or these are your action. And then your evaluation or your patient response. Okay. So for example, patient reports of pain. That is your problem. Okay. Ang ginawa mong intervention, nagbigay ka ng morphine, tapos kung ano naging response niya. Okay. So tingnan mo. Ang naging problem niya, 7 out of 10. So nung nagbigay siya ng morphine, bumaba yung pain scale niya. Okay. So that is your pie charting. And then we also have what we call focus charting or your DAR. Sa DAR, ito yung ginagawa sa MCU. Yan. DAR charting sila. So what is DAR charting? This is your data, okay? Or this is your focus or your problem. And then anong gagawin mong action or your intervention. Tapos anong ginagawang response. So example, a patient complained of pain, okay? Tapos ang ginawa niya action ay reposition. And then ano naging response ng pasyente. Okay, so that is also your focus charting pero mas shorten siya compared to SOPAI kasi ang nasa kanya DAR na lang, data, action, response. Sa MCU, DAR ang ginagamit nila. Yeah. So this is another example for focus charting. Ang data niya is pain. Nagbigay siya ng morphine. Bumaba ang kanyang pain level. Yeah. Then we have the charting by exemption. Pero commonly, hindi ito ginagawa sa mga hospital. Ayan. So the nurse document only deviation from the pre-established norm. Ayan. So kung makikita mo kapag ginawa mo yung charting by exemption, you are only focused on the deviation. So hindi mo tinitake note yung mga normal data which are also valuable. Then we have the computerized. This is very common for big hospital. Ayan. Kasi nandun na yung mga data, you're just gonna need to click lang. However, sabi ko nga, even though na computerized na, you need to have your critical thinking because ikaw pa rin na magde-decide anong kailangan mong ilagay doon sa chart. Then we have the case management process, a methodology for organizing client care through illness using critical pathway. So when you say critical pathway, nandun na lahat. Okay, this is commonly for nandiyan na yung doctor, okay, nandiyan na yung nurse, nandiyan na yung ibang healthcare team. Okay, kaya siya tinawag na critical pathway. Usually ginagawa to for patient severe case na kailangan nilang i-monitor. Ayan. So a critical pathway is multidisciplinary, ito yung sinasabi ko na magkakasama na yung mga healthcare professionals that specify assessment, intervention, treatment, and outcomes of health-related problem across timeline. Ayan. Then what are the forms for recording data? Cardex. Cardex, ito yung ginagamit nating information or yung patient record na nandun na yung name, okay, name, okay, nandun na yung diagnosis, okay, nandun na yung IVF, ayan, nandun na yung meds, okay, nandun na yung management, at mga other orders. So kung makikita mo, kapag during endorsement, ang hawak lang ng mga nurses ay yung Cardex, okay, not the whole chart. Kasi nandun naman nandun yung summary or yung abstract ng patient information. Nandun yung name, ayan, nandun yung diagnosis niya, nandun yung IVF niya. Doon sa IVF, nakalagay doon pang ilang bottle na, anong level, anong oras maubos. Yung sa medication, nakalagay doon anong ibibigay mo sa shift mo. Other management, let's say for example, kung yung diet niya, vital signs monitoring ba siya, for laboratory ba siya kinabukasan. Okay, so nandun lahat. Even yung other information, let's say for example, kung allergic ba siya kung saan. Okay, your flow sheet, this is your IVF. Ayan. And the nurse's progress note and discharge summary. Ayan. So the Cardex is used as a reference throughout the shift and during the change of shift. So yung sinasabi ko na during the change of shift, ito lang dala nila, Cardex lang. Why? Kasi nandun na nga yung client's data, nandun yung medical diagnosis, nandun yung medical order, tsaka yung other management. Okay, so this is like a summary or abstract nung buong chart. Ayan. Okay, so Cardex provides a concise method of organizing and recording data about clients. So ang ginagawa dun sa Cardex, usually naka-pencil lang yan. Okay, tapos binubura nila yung mga data nandun because you need to upgrade. Let's say for someone, pang ilang IVF bottle mo na yan or na-consume na ba niya yung gamot niya or na-update na ba nagawa na ba yung mga pending laboratories niya. Ayan. And Cardex is a series of flip card usually kept in a portable file and is a way to ensure continuity of care. Why continuity of care? Kasi yun nga, yun yung ginagamit mong document during endorsement. Okay, so tapos kapag mag-endorse ka ulit sa susunod na rounds, yun din ang gagamitin mo. Pero updated nga lang. Kasi di ba, ano na yun? That is under your shift na. Then it is a tool for change of shift report, but endorsement is not simply reciting content of Cardex. So when you say not simply reciting, hindi pwedeng babasahin mo lang. Hindi pwedeng ganun. Okay, so i-endorse mo talaga. So Cardex usually include the following data: the personal data. This is the name, the gender, the age, even the religion status. Ayan. The basic needs, the allergies, diagnostic tests, daily nursing procedure, kung meron kang vital signs monitoring, okay, kung meron kang sugar monitoring, kung meron kang I&O monitoring, ayan. Then medications and intravenous therapy, pang ilang IVF na niya, ayan. So kung ano mga drugs niya, ayan. Then treatment like oxygen therapy, gaano kataas yung oxygen therapy, o tukan nila ba yan, o face mask ba yan. Then entries usually written in pencil. Bakit? Kasi i-update mo ngayong Cardex kapag tapos na yung rounds mo. Kasi kapag tapos yung shift mo, kasi yun naman ang endorse mo sa susunod na papasok na shift. So we have another one, your flow sheet. Okay? So yung flow sheet mo, either your commonly ang ginagamit yung flow sheet mo sa I&O. Ayan. Ayan. So the information how flow sheet can be formatted to meet the specific needs of the client. So for example, graphic sheet for vital signs and intake na output. So bakit graphic sheet? Ayan. Kasi para makita na kaagad kung tumataas ba yung temperature. Paano ba yung graphic? Let's say for example, temp. Ayan. Tapos meron dyan dot. So ang gagawin mo, bibiligoy mo lang tapos i-connect mo dun sa dating temperature niya. Okay, so for example, 37 to. 37. Ayan. So 37. Yung shift mo naging 38. So idadat mo lang, tapos connect. Tapos naging 39, 40, 41, 42. So that is the purpose of your graphic. Nakikita na niya kaagad nung mga magbabasa ng chart kung tumataas ba or bumababa ba yung temperature ng pasyente. Then you have your nurse's progress notes. So used to document the client's condition, problems and complaints, intervention and responses, achievement of outcomes. So when you say progress notes, ano ba naging response ng pasyente? Ayan. Then discharge summary. Summary. Client status at admission and discharge. Then brief summary of the client's care, interventions and education, the resolve problem. Commonly, discharge summary ay gumagawa nito yung doktor. Ayan. Ang meron natin, ang ginagawa natin commonly, yung mga take-home meds niya, saka yung mga health teaching na kailangan natin gawin sa kanya. So we have reporting. So reporting is a verbal communications of data regarding client's health status, needs, treatment, outcome, and responses. Okay, so reporting is based on the nursing process. So we have the type of reporting. We have the summary hand-off report. Okay, so when you say summary hand-off report, you're going to give the data or the information. Then we have the walking around report. Ito yung pupunta ka sa mga kwarto-kwarto. Then you have your incident or occurrence report, kung may nangyari. Then telephone report and orders. Sa ibang hospital, ayaw nila ng telephone report and order. Okay, so usually ginagawa lang yan kapag mga emergency medication lang. For example, may nangyari sa pasyente, nakaalis na yung doktor, tatawagin mo yung doktor. Ayan. So usually yun ang ginagawa. Okay, so summary hand-off report commonly occur at change of shift or when the client is transferred to another healthcare provider. Then walking around is occur in client's room. Okay, so dala-dala nung nurses yung Cardex na pupunta sila sa room ng pasyente. Then incident or occurrence used to document any unusual occurrence. Kaya sa tinawag na incident. Okay, so IR. Yeah. Then telephone report. So again, sabi ko nga, very seldom ginagawa ito. So provide a clear, accurate, and concise information. Usually kapag meron tayong telephone report, meron kang second person to validate nung binigay na order sa'yo. Ayan. Para sure lang na tama yung nakuha mong information. Ayan. So the nurse document telephone report by including the following information: when the call was made, kailan daw ginawa, sinong tumawag, sinong tumawag, sinong kausap, to whom information was given, what information was given, and what information was received. then it will be validated by a second person or the second nurse. Ayan, second nurse. Ayan. So only RN may receive telephone order. So given by the doctor. Then the order needed to be verified by reporting clearly and precisely. Then the order should be countersigned once dumating ng pasyente. Ay, pasyente, yung doktor. Okay? So document, this is example of your telephone order. So decrease IV infusion at 50 units of regular insulin in 500 ml of the infuse at 5 units per kilogram per hour to Dr. Smith, Pat RN. Yeah. So dapat i-countersign to ng doctor pag dumating na siya kinabukasan. Okay? So what are the general documentation guidelines? So first, ensure that you have the correct client record or chart. Tama naman talaga, di ba? Baka naman nag-charting ka sa ibang pasyente, madugo yun. Ayan. Dami mo kailangan baguhin. Then, document as soon as the client encounter is concluded or to ensure accurate recall of data. And then the date and time of each entry. Okay? Kung kailan mo binigay yung meds, ayan. Then sign each entry with your full legal name and with your professional credentials. Do not leave space. Okay? So usually kapag meron space, nilalagyan nila ng ganun, no? Just to make sure na walang magsusulat dun sa spaces. Ayan. Kasi di ba, usually if this is the chart, ayan, tapos may space dito, ayan. So yung iba, sinusulatan nilang ganyan para to make sure na walang nakalagay. O usually, minsan sa doctor's order, di ba, magsusulat siya ng ganyan. Okay? Tapos meron magsusulat ulit ng pangalawang doctor. So usually, nilalagyan nila ng line yan. Okay? Para assurance na walang, hindi pwedeng may idagdag. Ayan. If an error is made while documenting, use single line to cross out, katulad ng pinakita ko kanina. Never change another person's entry even if it's incorrect. Use quotation marks to indicate direct line response. So yung quote and quote. Document in chronological order. Use permanent link. Huwag kang gumamit ng ballpen na nabubura. Then document all telephone calls. Yeah, so minimizing legal liability. So again, sabi nga natin, yung chart mo will protect you, di ba? Kasi yun yung pwedeng gamitin nyo as evidences. Ayan. Pero before makuha nung korte yung chart, kailangan mo rin merong request. Ayan. So first, do not forget to include the date and time, legibility, permanence, correct spelling, signature, accuracy, and so on. Ayan. So correcting error, paulit-ulit. Okay, so if you spell something on the chart, wag mong tawag dito, sirain yung chart. Wag mong sirain yung page. Okay? So kailangan pa rin yun. Then do not scribble out charting. Avoid using error or wrong patient when making correction. Follow your facilities policy. So commonly, yun nga, ang ginagawa kapag wrong entry, underline, tapos wrong entry, nakalagay, or mistaken entry, then your initial, and then the date. Okay? And thank you. Congrats. Yeah. So any question po regarding our last topic?
Stop recording ko na, sir.
Opo.